Good afternoon, everyone. My name's Owen Maxwell, and I'm your trainer and assessor this afternoon. So the topic that we'll be talking about today is first aid, but the session that I'll be running is a refresher in Doctor's ABC, which is your primary survey for first aid. So, Doctor, ABC.
Hi.
Hi there.
Hi, Mr. Maxwell. Sorry I'm late. Sorry.
That's okay. That's all right. No, thank you for letting me know that you're late.
Can I come in?
Yeah, of course. Of course, come in.
Okay, thank you.
Thank you. So as I was saying, sorry about that, I just got interrupted. So Doctor's ABC. So D stands for danger. So danger to myself, the patient, and everyone else in the vicinity. Just been interrupted again. As you can hear a bit of rustling. That's our resident dog Zeus. So if you do hear rustling or any movement or any fidgeting, that's actually from the dog, not from anyone in the class that's participating. Okay. So danger. So danger to myself, the patient, and everyone else. So we're looking at any safety hazards, anything that's going to cause any harm to me, any harm to any bystanders, or any harm to the patient itself. That could include electrical power lines that have come down in your area, slipping hazards, any sort of hazard that could interrupt your ability to be able to treat that patient. Okay, so response. So R for response. So what we want to do is we'll come across a patient and the patient's on the ground. What we need to do is we need to see if they're responding, if they're alert, if they respond to touch, to voice, etc.
Oh, shit! Sorry, that's my phone. Do you mind if I just take this? Hello?
Sorry.
Hello. Hi, yeah, no.
Rachel,
hi.
can I hold you one there?
Can you just hang on a second? Mr. Maxwell is saying something. Just 1 second, Mum. What?
So we can't actually have phones on in the class.
Oh, but it's my mum.
That's okay. If in the event that your phone does ring, if you could politely stand up and actually move outside. So this is your first warning, okay? We just want to be polite. I'm just reminding you of the rules and just making sure that you're aware of the rules and expectations of this class.
Okay, that's fine, I guess. But can I take this phone call from my mum or not, Mr. Maxwell?
You can.
Yeah?
You're very welcome to take the call.
Can I go now?
I need you to step outside and have the phone call, okay?
Okay.
Okay, there's no need to be rude. There's no need to sound disrespectful. There's no need for a tone, okay?
Okay, whatever. Yeah, Mum, Mr. Maxwell.
Once again, can I get you to leave the class, please?
Yeah,
Thank you. If you're going to take a call, can you please step outside and take that call?
Hi, Mum. What's up?
Thank you. Thank you very much. Sorry about that. We have a zero tolerance in this class for any rudeness, any disruptive behaviour, any sarcasm, any lateness, not listening, any aggressive behaviour, any talking over others. That's something that I'd like to emphasise to you all as a baseline, not just respect for myself as your trainer, but also for everyone else that's in the class. So just a reminding of the rules to everyone to be polite, to be courteous, emphasising respect, so respect for everyone and myself, and for the job that not just I'm doing, but also you as the learner, so that way you can absorb and you can interact and you can take in the information. In the event that someone does something good or someone answers a question, I don't just expect the encouragement and acceptance from myself, but also from others. So if someone says something that's really good, someone gives a really good answer, I would expect that not just myself, but also everyone else that's watching, that's actually in the class, to give that positive feedback and that positive reassurance, as in, God, that's a really good answer. Well done. And not just from myself, but from everyone else. So we want to check on the response of the patient. So to do that, what we can actually do is we can actually touch the patient's shoulders and give them a little bit of a squeeze in the traps. And you want to see if they're responding to any pain or any stimuli. what we're also doing is we want to ensure that they can hear us, and that way we're using our voice. We're saying, "Can you hear me? Open your eyes. What's your name? Squeeze my hand," so you can actually hold the person's hand and squeeze their hand. So what we want to do is we want to identify whether they're alert, which is A. So whether they're talking to us face to face. Then there's voice, which is responding to the sound in my voice and opening their eyes if their eyes are closed. So opening from closed to open. And then there's also pain, which is what we demonstrated before, which is squeezing the traps. So they're responding to pain. And the U, which completes the acronym AVPU, AVPU, is if they're completely unresponsive. So they're not alert, they're not responding to voice, and they're not responding to pain. In the event of this, they are classified as unresponsive and unconscious. So after we've done check for danger, D for danger, R for response, we want to follow the next step, which is S, which is send for help. So if you haven't got the ability to send for help yourself, whether you don't have a mobile phone on you, you need to track someone down to send for help. So yelling it loud, "I need help," very, very loudly. Catch the attention of someone around you, and they can actually call the ambulance for you and to stay with you. The next step is airway. So A for airway. So what we want to do is the patient's laying down flat. We want to check their airway and see if their airway is clear. So what we do not want to do is we do not want to move the patient's head forward and back. They could have a possible spinal injury. And if there is something caught in their throat and the back of their mouth, if you tilt the head, it will actually roll backwards into the actual throat, which we don't want because that could cause an obstruction in the airway. So what we're going to do is we're going to open up the patient's mouth using the pistol grip, opening up, checking if there's any obstructions. And if there is, you want to roll the patient over into the recovery position, which is on their side. To do that, I can't actually demonstrate it here because we're not in the facilitation of that, but to all of you that know that you're doing a refresher, as you're doing a refresher of first aid, we want to roll the patient into the recovery position, which is on their side. And once this is done, you can use your own fingers or the patient's fingers, making sure if you're going to use your own fingers that you've got gloves on, and you want to scoop any obstruction out. So once that's done, you roll them back onto their back, and you've double checked that, yep, it's clear. So then what you want to do is you want to tilt the head backwards and open up the mouth again, and you want to have another look and just double check that there's nothing in there. And now we want to check for B, breathing. So DRSABCD for breathing. So what we want to do here is we want to have the head tilted back, mouth open. You want to put your ear to the mouth, and you want to look, listen, and feel for breathing. So you want to put your hand on the diaphragm, which is just below the rib cage, just around the belly button region, just above the belly button. You want to put your hand there, your ear to their mouth, and you're looking for the rise and fall of the chest. You're listening with your ear to their mouth to see if you can hear anything, as in if you can hear any breath, feel a breath of air on the ear, or even the sound of breathing or even possible gurgling. And then feeling with that hand that's on the diaphragm, you want to feel for that rise and fall of the chest. So if you do feel breathing and you do find a presence of breathing, roll them back into the recovery position because they are breathing. If they're not breathing, we want to go on to the next step, which is C, which is for compressions. So we've checked their airways are clear. They're not breathing in any capacity, so they're unresponsive. So C for compressions. So what we want to do here is we need to initiate CPR, which is compressions. So we want to find the center of the chest, find the nipples, and in line between the two nipples, that sweet little spot there, which is the sternum, you want to compress. So you want to use the palm of your hand, a straight arm. You can either interlock fingers or hand on your wrist, keeping nice and straight. You want to ensure that all your body is up to the side of their body, to making sure that you're not slouching forward. So you're upright, shoulders back, and then you're going to do your compressions. So you want to do 30 compressions for 2 breaths. And you want to keep doing that until help arrives. So once you've done that, once you've started CPR, once you've started the compressions, either yourself or a bystander will use a defib. So D for defibrillate. And to defibrillate, it's a very simple process. There's actually instructions that are in the AED itself, and it's audible. So you can actually listen to the instructions and not just listen to them, but you can also read them. So you want to attach one pad on the chest, just above the breast, and then another one on the side, and you want to follow the directions of that, and it'll tell you that they're analysing the patient and to stand away. So do not touch the patient, analysing for a heart rhythm. It's analysing for 2 different things, for 2 separate shockable rhythms, VF and VT. And those are the 2 rhythms that the defibrillator can shock. So it's a distorted electrical activity in the heart, which is confused. It's a confused rhythm. It's a misfire. So there's presence of electrical activity, but it's not creating what they call a sinus rhythm, which is a standard heartbeat. It could be an irregular heartbeat. We're not too sure. But we don't know why this has happened, but that's the reason that we have the AED. So once we've got the AED on, we've analysed the patient, it'll analyse if a shock is needed or not. If it says shock advised, stand away from patient, don't touch the patient, it will shock automatically. And then once that shock has been delivered, it'll tell you to continue CPR, and you continue to do that until help arrives. Yes, question.
Mr. Max, I have a question.
Yes.
Why do we have to use the defibrillator if we're delivering CPR anyway? Like, why is it necessary? Because wouldn't compression of the chest and breaths be sufficient enough to restart the person's heart?
Really good question. Really, really good question. That's a really good perspective and a really good point of view. So when it comes to CPR, compressions and breaths alone,
yeah,
generally 9 times out of 10 would not bring a patient back.
Oh, okay.
It depends on the condition that the patient is experiencing, depends on the situation that you're in as well. So there's quite a few different variables. The AED is a great life-saving tool. The only way how an AED can actually work and can deliver a shock is if there is a shockable rhythm that it detects. So as I described before, the VF heart rhythm or a VT heart rhythm. So compressing on the chest for 30 beats per minute and then initiating two breaths, what that will do is all the blood that's still in the system, it's going to still circulate that blood around the system. It's going to help carry that oxygenated blood that's still present. So if you choose not to give breaths for a patient, that's totally fine. That's within the CPR Council and the Resuscitation Council. If you do not feel comfortable in giving breaths, you do not have to.
Yeah, I guess especially with COVID at the moment, you don't know what you're going to catch off other people.
That's right. And your safety is paramount, not just having the patient on the ground who's unresponsive and is in a life-threatening situation. Your safety as well is vital. You don't know what biological pathogens this patient might have. They could have a disease that could be contracted and transmitted via saliva. You don't know. That's why whenever we touch a patient, we always wear gloves and we always have PPE. You're not always going to have access to latex gloves. It's not always going to be a thing. But your safety is paramount. So in the event that you're pausing compressions and you're giving 2 breaths, yes, it is great that 2 breaths can be initiated to the patient. That's great that we're getting more oxygen into their system to be able to be circulated around the system. The lungs themselves can hold about 8 to 10 minutes worth of reserve oxygen. So as long as the head is tilted back, the airway is open to the atmosphere, while you're doing chest compressions, you can continue to just do chest compression after chest compression after chest compression. Because what that's doing is, yes, you are compressing the chest, you are circulating that blood around the system, but what's also happening is your lungs are compressing. So they're opening up and they're closing. They're opening up and they're closing, as well as having that reserve oxygen in the lungs. We don't know how quick an ambulance is going to take to get there. But the fact that you've got that early intervention and you've got that early CPR and that early care, which can lead to successful resuscitation of that patient, every little thing counts. So the fact that you're just doing a compression and multiple compressions and continuing that until help arrives, the ambulance will most likely show up and they'll tell you to keep doing what you're doing. So what we do is we do not stop CPR in the event that help has arrived. You continue doing CPR until you're told from an ambulance officer, a police officer, a doctor, even the coroner. A healthcare professional and practitioner has the ability, that is certified, to tell you to stop doing CPR. So what they will do is you'll most likely continue to do CPR, continue to do chest compressions. They'll work around you. So if you don't have access to an AED, they will put an AED on for you. They'll have one in their kit. They'll have one with them. That's standard procedure. They'll put an ECG and a defibrillator on the patient. And then once they've set it up with all their little settings to the point that they're ready to take hands off and analyze the patient, they will tell you.
Okay. So that makes sense.
Yeah.
Okay.
So when you stop doing CPR, when you stop doing compressions on a person's chest, what's happening is you're stopping the flow of that blood. You're stopping the flow of that blood within that person's system, which is reducing the amount of oxygenated blood to their brain. Once the brain receives about 2 to 3 minutes of starved oxygen, that's when cells in the brain start to die. And that's when brain disorders can actually initiate. And the term of becoming a vegetable, that's when that can actually happen. So, yeah.
Okay. Cool.
Yeah. So thank you, class. Thank you for everyone's input. Unfortunately, we had to make a few corrections to someone's lateness. But that's okay. That's okay. We're all different. We're all here for different reasons. And it's really good to see a lot of positive questions, a lot of positive feedback. It does feel like I've talked more at you than you to me, but that's okay, because what we're doing is I'm communicating to you the refresher of DRSABCD. So it's the refresher of the primary survey and what to do in an emergency. So a lot of feedback that I've received from students is they like to have a trainer that communicates to them. Yes, questions, just like Rachel did before. Questions are well wanted and well needed to express that communication from not just me to the student, but also from the student to the trainer. And I think that's very vital. I was using hand gestures for a little bit of it as well, just to ensure that the visual learners, they've got something that they can actually hold on to. So yes, there's one thing about communicating and expressing your voice and talking to people. That's audible learners, but then you've got visual learners, which use physical tools to be able to connect the dots in a way. So yeah, I hope you've enjoyed the lesson and you've received a lot from it. And thank you very much for your time.